we're looking at 3 hospitals right now in the north that asked to be evacuated. But again, the important point is where to. There's no safe space. The only places they can go to right now are non-specialized hospitals in the south, non-specialized hospitals that are overcrowded already, that are struggling to take care of those who are already there with no water, no food, no electricity. And that's a situation all over Gaza. Let's not forget that. We're talking about a hospital of high attention right now, Al-Shifa, but Al-Shifa is Gaza, and Gaza is Al-Shifa right now. The situation there is the same everywhere, and people are safe nowhere. When these people, the doctors, the nurses, the patients asked to be evacuated, that's really the last resort. That means that the situation on the ground has grown so dire that the only other alternative is facing what they think certain death as the hospitals are under attack, as Al-Shifa is under attack. So these evacuations need time, they need preparation, they need specialized equipment, they need a safe passage, they need the coordination with IDF, and of course also with Hamas. To get to a safer place inside Gaza, and I stress safer place because there is no safe place in Gaza, to be then stabilized and eventually be transported out to Egypt. Al-Shifa is not yet completely evacuated, but let me start differently again here. W.H.O's priority is not evacuating the hospital or the hospitals. The hospitals are the only safe space for any population to go to when all the last resorts have been cut off. The hospitals should be the last safe place where people can go to, because taking away a hospital from an area doesn't only mean the physical evacuation of the patients and the doctors and the nurses. It means robbing the entire population of that area of the last resort to go to seek healthcare, the last resort of humanity when you're injured, when you have a regular disease, when you have asthma, or when you have shrapnel and bullet wounds or crush injuries from the ongoing war. Over 30% of the deaths and injuries are in the south of Gaza, in the so-called safe area. Over 30% of the deaths are in the south of Gaza. Then came the bombing and the attacks of the hospitals, and now no more hospitals functioning in the north. Colleagues from MSF have been reporting that they were attacked too, one of the last resorts there. So taking away healthcare of people is taking away the last resort, is taking away the last piece of humanity. And that's what's happening right now.
If children's access to water and sanitation in Gaza continues to be restricted and insufficient, we will see a tragic yet entirely avoidable surge in the number of children dying. It's also important to note it's starting to rain in Gaza. Now, combined, children face a serious threat of mass disease outbreak. this, of course, would be lethal. So we have then, on top of the mortars and the bombs, a perfect storm for disease, for the spread of disease. It's a perfect storm for tragedy. We have a desperate lack of water, fecal matter strewn across densely populated settlements, an unacceptable lack of latrines, and severe restraints on hand washing, personal hygiene, and cleaning. We're already seeing almost 10 times the monthly average reported cases of diarrhea amongst children under 5, in addition to increases in scabies, lice, chickenpox, and respiratory infections. The threshold for a bare minimum amount of water per person per day, be that in war or famine-like conditions, is 15 litres, far below what people were regularly getting in Gaza before this conflict. Now, that 15 litres is to cook, to clean, to wash, it's for everything, all absolutely critical if we're going to prevent waterborne and other infectious diseases. Yet there are parts of Gaza now, particularly in the north, where as many as around 700,000 people are, where people struggle on as little as 3 litres a day. And on some days, given the problems with distribution and the immense devastation, on some days it's none at all.